ambulance shifts, additional vehicles, whatever it takes to keep serving New Yorkers who are in emergencies. We're also going to make sure that folks who don't have a pressing emergency, because we all know for years and years folks have called 911, and most of those are true emergencies and some of them are not. Anyone who's calling and needs something else, doesn't need an ambulance but needs a different kind of help, we're going to find a way to get that to them too, so ambulances are never going to a place that they don't need to be. But what we have to do first and foremost is put on more personnel, more ambulances, more shifts, and we are doing that immediately so we can serve the true emergencies, and there's a lot of them, to make sure that New Yorkers get the help they need. Obviously, there's been a lot of attention on the situation in our hospitals in general, and in particular at Elmhurst Hospital in Queens. I'm just going to give you a few quick points. Dr. Mitch Katz here with me will talk about Elmhurst and health and hospitals more specifically. But look, the bottom line is the incredibly valiant team at Elmhurst has gone through so much in the last few weeks. It's an extraordinarily effective hospital, real professionals who have found a way to keep saving so many lives while dealing with such pain at the same time and real loss. And you can imagine how hard it is for people whose whole life is saving lives to see that sometimes there is no way to save a life. But they have been doing amazing, amazing work to save so many others. We've been sending constant reinforcements, so 169 clinicians have been sent in recent days to Elmhurst. That means physicians, registered nurses, nurse practitioners, and physician assistants. 100 nurses this weekend alone. In addition, within the hospital, clinicians have been moved from outpatient activities to ICU activities. Staff from the central office of health and hospitals are moving in, taking on roles in terms of ICU and emergency department. We're going to keep moving personnel and getting more personnel constantly to help Elmhurst and every other hospital that needs it. This is going to be an extraordinarily tough next few weeks, but we will keep sending more and more reinforcements. And again, we have to get the good people there doing such tough work. We have to get them a break. We have to spell them. And this is why I want to see medical personnel come in, not just from New York City, but from all over the country, including those military medical personnel, because we have to give these extraordinary heroes a break at places like Elmhurst. Also, ventilators, we have added 55 ventilators to Elmhurst over the past 2 weeks, and we will keep adding whatever number of ventilators they need. So this will be a nonstop effort. Across health and hospitals, the whole system, the 11 hospitals, 500 contract nurses have been added already, 500 more coming this week. So we are just going to constantly reinforce. Now I want to turn to supplies and the distribution of supplies, and I've already said our first milestone is this coming Sunday, April 5th. We must shore up to get ahead of the challenges we will start to face that following week. So this is a race against time. We have gotten some real help, as I said. The ventilators that came in from the federal government, some are coming in from other sources. That's helpful, incredibly helpful. We need it all, and we are thankful for it all. Yesterday, we sent 1,400 ventilators out to our hospitals, to all types of hospitals. That is a huge step forward, but that number we need overall is still 15,000. So we've made a big dent between different sources. To get toward that 15,000, we have a long, long way to go. We still need to see the federal government do a lot more and more quickly. We need the Defense Production Act utilized to the maximum. We need to see a distribution system that's fast and intense. And again, I think the military must be involved. And again, my specific request to the federal government is 400 more ventilators by April 1st to get us ready for later in the week. When we expect the upturn to really intensify, and we need those ventilators to be in place and ready. In terms of personal protective equipment, PPEs, a very moving moment yesterday when the United Nations provided 250,000, 250,000 surgical masks to the people in New York City, to our healthcare workers, our first responders. The United Nations, we are their home, and they did something very good for their hometown with 250,000 surgical masks, and we've asked them any and all help they can provide going forward. We will need it, and those masks are getting out to our hospitals right away. Dr. Katz will speak to the overall situation, but my message to all the doctors, the nurses, the hospital staff, starting with all our colleagues at Health and Hospitals, our public hospitals, but to all those out there in the voluntary hospitals, the big hospital systems, the independent hospitals, we are all in this together. We're going to go and work to get you every conceivable supply you need and get it to you quick. We have to protect our healthcare workers, and that's what we're working on every single day. And we can only, all of us who are not healthcare workers, can only imagine what you all are going through. We have to be there for you and get you all the help, including the additional personnel, immediately. That's our job. In terms of health capacity, we're all really moved by the fact that the USNS Comfort is arriving tomorrow. I'm really looking forward to greeting the men and women, the medical professionals, the sailors, everyone who's making this possible. I want to thank our colleagues in government at the Economic Development Corporation who played a crucial role for the Comfort to dock and be able to add immense hospital capacity for the city instantly upon docking. Well, they had to be able to dock, and they weren't going to be able to dock unless the dock was dredged to allow for a ship of this size. The operation was supposed to take 2 weeks. The folks at EDC, working with the Army Corps of Engineers and the State Department of Environmental Conservation, they got the job done in 8 days. And so the Comfort will be arriving tomorrow and will right away be making a difference in this city. And we are so, so grateful to the Navy, to the military, that this new help will be arriving in our city. Also very important in Central Park, and we're going to be using every place we need to use to help people. Mount Sinai Hospital, working with the relief organization named Samaritan's Purse, is creating a 68-bed field hospital. So this is the kind of thing you will see now as this crisis develops and deepens. A partnership with Central Park Conservancy, our Parks Department, the Mayor's Office, we all work together to get this done with Mount Sinai and Samaritan's Purse. Going up now in the East Meadow, should be operational by Tuesday. Some other quick updates for you, and then I'll turn to Dr. Katz, and then we'll go to questions. There have been concern about those incarcerated. Update in terms of our jail system. As of last night, over 650 inmates have been released. Again, working carefully with the state of New York and the DAs, and being very, very mindful of public safety while also being mindful of deep humanitarian concern. Over 650 released. I can update you and say that since this crisis began, our jail population is down by about 860, not just because of the releases, but because we've seen falling crime and lower arrests. Want to thank the DAs and the state for their collaboration and cooperation, working all together. And the state, I think, made an important decision related to those on parole and working through the right approach there. I just want to commend the state for that. There's been concern about our juvenile detainees. A number of actions have been taken. Over the last 2 weeks, there's been a significant reduction in our juvenile detainee population. There's been a 67% reduction in one category, 53% reduction in another category. So when you combine that, obviously, we've been able to reduce very, very substantially. It was not a huge population to begin with. We'll get to the exact numbers. But more than half of those who had been detained over the last 2 weeks have been released, again, while always making sure there is follow-up and monitoring to protect safety. I want to thank our Deputy Mayor for Health and Human Services. I want to thank the Law Department, the Mayor's Office of Criminal Justice, and the Administration for Children's Services for working together to ensure that was done properly and quickly. Related to transportation, a couple of things. Staten Island Ferry, we had made a substantial reduction in service because ridership was down so intensely. We have seen ridership continue to drop. It is now down 86% from the same time period last year. As a result, as a result of lower ridership and the need to conserve resources and a number of factors, we're going to be moving to hourly service on the Staten Island Ferry. That will be 24/7, but it will be hourly service. There's so few people using the ferry now compared to what we normally have that we had to make this move. It'll go into effect at midnight tonight. And then related to our subways, we've gotten some reports of crowded subway cars, despite obviously a huge reduction in subway usage. Obviously, there's been service reductions as well. We've had some times where there was a service problem, and that led to, in other words, service had been delayed, and that led to some crowding. We are going to work together, the MTA and the NYPD, to go and do spot checks and immediately intervene if we see any subway cars that are crowded. I want to ask all New Yorkers, again, this should not be something you see very often. If you're on the subway, it means, of course, to begin with, you're an essential worker or you're doing something essential under the rules. There obviously should be a whole lot of New Yorkers who have no reason to take the subway at this point. But if you do have actually essential reason to be on the subway and you see a crowded car, we want it reported immediately to 311 so the NYPD and the MTA can act on it. And if you're an individual in the subway and you see a crowded car, please avoid that car. Please go to a different part of the train or wait till another train comes. It's crucial that we avoid any crowded cars. What social distancing means everywhere, including in our subways. I'll finish up and then a couple words in Spanish. On a very, very important topic, which is the direct relief that New York City needs from the federal government. I had several calls today and over the last few days with Senator Schumer, who is not only our senator, of course, but is the Democratic leader in the U.S. Senate. I spoke as well this morning with Treasury Secretary Mnuchin. The two important topics. The first is regarding the third stimulus just passed, ensuring that the resources devoted to New York City could be accessed immediately. That's $1.4 billion so we can keep providing essential services to New Yorkers. I'm very satisfied, based on the conversations with Senator Schumer and Secretary Mnuchin, that we will have access to that money very quickly and under rules that will be very usable and flexible. So that's good news. But I immediately spoke to both about the need for the fourth stimulus, for action to be taken in the month of April by the Congress to provide real and immediate relief to New York City and New York State, given the vast new expenses that we are incurring to help people, to save people, to protect people. We must get additional support. We all know all parts of government are losing a huge amount of the revenue we depend on to provide services to people. The Congress, the president have to act to keep New York City and New York State whole. It's the right thing to do morally. It's the right thing to do to protect people. And anyone who wants to see a recovery, you're not going to have recovery if the nation's largest city and one of our largest states cannot do our work and are not going to be solvent. We need that support. So I spoke to them about that, and I feel, in addition to the conversation last week with Speaker Pelosi, I feel hopeful that additional help will be coming. Finally, just to say, we're having a strange experience. All of us would go out in so many parts of this city and see something we've never seen before, or only once in a while during a blizzard or some very exceptional event. We see a lot of empty streets, a lot of empty sidewalks. I'm sure it feels strange. It feels strange to me. I'm sure it feels strange to so many of you. Remember that that's a sign that New Yorkers are taking the instructions seriously, that they are doing the right thing. The vast, vast majority of New Yorkers are doing the right thing. The vast, vast majority of New Yorkers are practicing social distancing, are really only going out when they absolutely need to, and are staying in otherwise. And I really want to thank New Yorkers, all of you, for the way you're handling an incredibly tough crisis. Again, we will get through this together. It will not be easy, but we will get through this together. Quickly in Spanish. Cada vez más estamos perdiendo neoyorquinos que están al frente de esta crisis. La ciudad está trabajando día y noche para apoyarlos con todo lo que necesitan. Todos los podemos ayudar. Hay que quedarse en casa para no propagar el virus. With that, I want to turn to the head of our health and hospital system. The men and women under his command have been doing extraordinary work, and he has been doing extraordinary work keeping the largest public health system in America running in the midst of the biggest public health crisis that we've had probably in a century in this country. I want to thank him for his leadership and his spirit and for the great work of the people that he every day commands. Dr. Mitch Katz, CEO of Health and Hospitals.
Thank you, Mr. Mayor, for recognizing the amazing heroes that are working every day at Health and Hospitals, as well as the private nonprofit hospitals throughout New York City. It is extremely difficult work. People know that the vast majority of people who are COVID positive who get the virus do just fine. 80% of people don't need hospital care. Of the 20% who need care, only 5% of the total need ICU care. But imagine it the other way. You're a doctor or a nurse at the hospital, and what you see is patient after patient coming in critically ill, and your actions are determining whether that person has all of the medical care they need. And our staff are performing so well under very difficult conditions. Our emergency rooms are about twice as filled as usual. Our intensive care units are about 3 times as large as usual, and still our staff are often using new equipment, working with new colleagues that we have never, who have never been in that hospital before. People are learning together. People are rising to the challenge. It's extremely difficult work, but they are doing it. I want to be clear that everyone who has needed a ventilator has gotten a ventilator, that people who need the protective equipment have gotten the protective equipment, but there is tremendous anxiety about the coming weeks, and that's why we're so grateful to you, Mr. Mayor, for advocating for our healthcare workers to make sure that they have the equipment that they need, both the equipment in the sense of ventilators to save lives, as well as the equipment to protect them. We know that there's a lot of fear that that equipment is going to run out, and we're so grateful to you for your advocacy efforts. Thank you.
Thank you, Dr. Katz. Okay, we are going to go to questions, and please let me hear the name and the outlet. Go ahead.
Hi, all. Just a quick note at the top. We'll ask everyone to limit themselves to just one question in an effort to get to as many outlets as possible. Also, just a reminder that we have Dr. Barbeau, Police Commissioner Shea, Fire Department Commissioner Negro on the phone today. With that, I will start with Todd from AM New York.
Okay, Mr. Mayor, Dr. Barbeau, I'm interested in finding out, with the growing loss of life from coronavirus, can you speak to what is being done to accommodate the influx of bodies and people we've lost, the relationship with the funeral homes, and whether or not there's any risk to people handling the bodies or even the loved ones of passing on COVID-19 after people have died?
Todd, it's a painful topic to say the least. Dr. Barbeau can talk about the safety measures in place and the concerns, if any precautions need to be taken. I want to say that, look, I'm going to keep, whenever this topic comes up, I'm going to keep it very broad and very brief. We have the ability to deal with this very, very tragic part of this reality. We have gotten a lot of support from the federal government to make sure we had what we need to deal with it. All I can tell you, I'm not going to go into detail, and my colleagues can get you more detail after this press conference, but we have what we need to deal with an absolutely tragic situation. Our job is now to focus on what we need to do to save lives. Dr. Barbeau, do you want to speak about how precautions are being taken?
Yes, sir, Mr. Mayor, and I want to just echo what you've said in terms of all of our efforts thus far really being geared at reducing the spread of this virus and giving the healthcare system an opportunity to absorb the number of individuals that are unfortunately be stricken with COVID-19. With regards to COVID-19 and people who have deceased because of it, there is no indication at this point in time, based on experience from other countries, based on the science that has been published, that there's any risk to individuals from this respiratory virus. I want to remind you that it's a virus that's spread by droplets, and after someone is deceased, there is no risk. We at the health department are very focused on working with funeral homes and ensuring that as one of our essential services, our burial desk is working 24 hours a day to help meet the needs of families that have unfortunately lost someone to COVID-19.
Okay, go ahead.
Next, we have Shant from the Daily News.
Yeah, thank you, Mayor. I was wondering if you could elaborate a little bit on what you want to see from a fourth stimulus. Do you have a dollar figure in mind, and what kind of things that funding would go toward?
Yes, Sean, and this is a conversation, look, and I'm always grateful when our federal officials are responsive. Secretary Mnuchin was very responsive. Obviously, on the legislative side, I've spoken to Speaker Pelosi and Senator Schumer. They've been extraordinarily responsive. There's no question in my mind at this point that a fourth stimulus bill is coming, and coming relatively soon. I spoke to Senator Gillibrand about this as well. Everyone's saying the same thing, and that's a very encouraging sign. Our delegation, I spoke to the entire congressional delegation a few days ago. Obviously, Congressman Jeffries is very high-ranking in the House leadership as well. Everyone is agreeing that another stimulus bill is coming soon. We have to ensure that that stimulus bill reflects what's happening now, not just in New York, but increasingly, tragically, all over the country. And you have noticed coronavirus doesn't discriminate. It is now in all 50 states, red states, blue states, big and small. The next stimulus needs to replace the lost revenue that cities and states have lost as a result of coronavirus. There is no other viable path to making up the kind of revenue we've lost, billions upon billions of dollars, very quickly, more to come, unfortunately, while we're trying to keep essential services going. And I want to remind everyone, anything that's about saving lives right now, money's no object. We're going to do everything and anything to shore up and strengthen our hospitals, to support our first responders. Whatever it takes to save lives, that costs a lot of money, and it is the right way to use money. But if you combine all the huge new expenditures with all the loss of revenue, and we have to provide the basics every single day, we still have to fight crime and make sure the garbage is picked up and everything else that the city does. I think it should be literally replacing the lost revenue and funding the additional expenses that were incurred because of COVID-19, and that should be for all states, all cities. But this time, instead of a bill that treats everyone like there's no differences in the reality, this bill must reflect where the actual epicenter has been and ensure that New York City and New York State are truly whole.